Dana Tyler.
52-year-old Catherine Rice is lying on an operating room table at NYU Medical Center, where surgeons are removing a cancerous breast. She has always feared this moment. Her mother and aunt both had breast cancer too. But when Catherine wakes up from surgery, she will have a new breast.
They will take a flap from my abdomen, tissue, skin tissue, fat, from which they'll reconstruct the breast, which I can stand to lose a little of anyway.
Catherine has two doctors here. Her surgeon, Stephen Hofstadter, is first removing her breast. Plastic surgeon Stephen Colen will fashion the new one.
It's most important that women are made aware that this option is available to them, and also that it's available to them at the same time as the mastectomy.
A woman confronted with the diagnosis of breast cancer faces two demons, the cancer itself and the loss of her femininity. Experts say that is why so many women avoid mammograms, but Catherine felt differently.
Not knowing and letting something go is far worse than finding it early at a stage when you're able to absolutely do something about it.
Abdominal flap surgery is not for everyone, but it worked for Catherine Rice. Because of her family history, she had mammograms, which led to early breast cancer detection. The cancer had not spread from the breast, so it was all removed with the breast, making reconstruction an immediate option. Catherine's new breast comes from her own body.
We have three areas to choose from. The best area is the woman's abdomen, and certainly at the age that women get breast cancer, they have extra tissue on their abdomen, and they almost get like a little tummy tuck.
And if there is not enough abdomen tissue, buttocks or back tissue can be used. The surgeon cuts out the abdominal tissue with its own blood vessels. That tissue and its vessels are then attached to the prepared chest. The vessels will nourish the tissue, and after healing, the patient has a new breast. 2 days after surgery, Catherine Rice is recovering well.
I feel surprisingly good. I don't have any pain today, mainly just stiff. I feel very tight.
It's good to see you smiling.
Yeah, well, it feels good to be in this kind of shape.
Bess Reiner chose a different reconstruction route after her mastectomy, an implant.
First they put an implant in that is used to stretch the skin, very similar to being pregnant.
The first step was to insert an inflatable implant. Every couple of weeks, more salt water was added to stretch Mrs. Reiner's skin. When the size of that implant matched her other breast, the permanent silicone implant was put in. Bess did not like wearing a falsie that slipped into a special bra.
There were days that I just wanted to take it and fling it out of the window. I mean, it's a reminder of the ordeal that you went through.
At 63, Reiner says she was not about to give up on life. Now she skis, swims, and plays tournament tennis, all now with her body intact.
What a procedure. How long was she on the table, Dana? It was just
about 6.5 hours.
that long to do both.
To do both things.
Yeah.
And she feels great, and she's very, very happy that she did that.
Great, yeah.
Wonderful. Thank you.